Is it your blood sugar? Is it your thyroid? Is it your cortisol? Or could it be perimenopause? It could be one of those things. It could be all of those things, but it is rarely just one thing because all of those body systems are deeply connected and a lot of those symptoms deeply overlap. So let's break this down and let's dive in. So, all of those body systems, your blood sugar regulation, your thyroid hormones, your cortisol, which is secreted by your adrenal glands, and your reproductive hormones, which are produced from puberty up until menopause, those are produced mainly by your ovaries. And that's all part of the endocrine system, the hormonal system. So, not only are those body systems intimately connected, but they're also heavily influenced by all body systems from head to toe. So, when it comes to these symptoms, a lot of my clients will come to me and think, is this related to my thyroid? Is this related to chronic stress? Is this related to my gut? Is this related to hormone changes? And when they say hormone changes, they typically mean menstrual cycle changes, perimenopause, menopausal changes. And what I will share is that there is a lot of connection, but there's also a lot of overlap in symptoms. And that's what I'm going to break down today. So, let's talk about blood sugar first. So, when it comes to blood sugar dysregulation or blood glucose, our glucose is heavily regulated by our insulin, which is secreted by the pancreas. There's also glucagon, which is a hormone that is secreted by the pancreas as well. And it's also heavily influenced by this brain gut axis, as well as everything else combined collectively. So, with blood sugar dysregulation symptoms, a lot of people will have blood sugar swings, which could be hypoglycemia, where the blood sugar maybe has shot up, has risen quite a bit, and then it drops. It drops actually a little bit too low, and that's called hypoglycemia. You have what's called hyperglycemia, often induced from many different factors. The most common would be post meal, where your blood sugar is way too high, your blood glucose is way too high. Insulin now rises to lower the blood sugar, and that can still lead to what's called hyperglycemia, or in some cases, hyperinsulinemia. That can be related to insulin resistance, that could be related to prediabetes or diabetes, and that could be related to other things as well, chronic stress, hypothyroidism, and so forth, perimenopause. So that can often cause symptoms of fatigue, brain fog, that can cause symptoms of maybe like an afternoon crash, that could cause interrupted sleep, that can cause weight gain. And a lot of those symptoms that I just mentioned can also be found in things like hypothyroidism, a low thyroid. That could be found in things like perimenopause and menopause, the fragmented sleep and the weight gain and the fatigue and brain fog, and so forth. So, the next section that I want to talk about, or the next body system, would be your thyroid. So, your thyroid hormones are mainly produced by your thyroid gland located here at the base of your neck, mainly your T4. And your T4 is stimulated through communication from the hypothalamus, pituitary, and to the thyroid gland. Same thing with the other body systems. There's this brain body connection, this brain body communication that heavily regulates our hormones and our body systems. And so, with our thyroid gland, if let's say you have a sluggish thyroid, or your body isn't producing as much T4 hormone, or it's not producing enough thyroid hormones, or it's not converting as much from the inactive form T4 into the active form T3, that can lead to symptoms like weight gain, constipation, fatigue, brain fog, hair loss, hair thinning, eyebrow, eyelash thinning. It can lead to dry skin. It can lead to intolerance of cold weather. We've got previously we had a little bit of snow and rain and actually hail a little bit ago. Looks like the sun's coming out. So cold intolerance, and a lot of those symptoms can also be found in perimenopause or menopause, thinning hair, skin that's drier, interrupted sleep, that can be a hypothyroid symptom, sometimes too much sleep, the weight gain, sluggish digestion, sluggish metabolism can be found in hypothyroidism as well as perimenopause. And the next body system that I want to talk about is cortisol. So, cortisol is one of our stress hormones. It is actually an essential hormone. And at some point, I want to do another video on the importance and the powerful influence of cortisol in the body. It's not bad. We actually need an abundance, a generous amount of cortisol for a healthy body, a healthy life, healthy vitality, and it is essential for our body, for our existence, for many many reasons. It's all about moderation. It's all about the balance between excessive versus depleted. So cortisol, in the case of stress, acute stress versus chronic stress, and both of those are very very common and normal actually. Our body's designed for acute stress. It is not designed for long term chronic stress. So, in this case, if our body is secreting too much cortisol over a long period of time, and again, that's subjective, some people can withstand a bit more cortisol or stress in their life. Stress tolerance or their stress resilience is much stronger than, say, other people. So it really is personalized or individualized. Too much cortisol over time, too much chronic stress that is secreted, and there's not that balance, that dance between the parasympathetic and the sympathetic nervous system, then that can lead to things like fragmented sleep, that feeling of anxiety, the feeling of depressed mood in some cases, hair loss, thinning skin, excess inflammation, more pain, more achiness throughout the body, and irritable bowel syndrome, and so forth. And a lot of those symptoms can also be seen in hypothyroidism, the hair loss, like irritable bowel syndrome, the achiness. A lot of my thyroid patients feel like their body feels more inflamed because that metabolic rate is not at that efficient level that it should be. So, more inflammation with excessive cortisol, and actually not enough cortisol will also cause too much inflammation and achiness throughout the body. The overlap between cortisol and perimenopause could be the periods, the menstrual cycle gets interrupted, where, especially with too much cortisol, too much excessive duration or excretion of too much cortisol can lead to either a stopping of the period or it'll interrupt the normal cycle. So it may not be every 28 days, you might be skipping, it might happen sooner. It tends to shorten that luteal phase, tends to shorten the luteal phase, which is from ovulation up until menstruation. So that can be shorter. You might have a sooner bleed, maybe around day 21, 22, 25. You might skip, you might have mid cycle bleeding, mid cycle spotting. In some extreme cases, severe chronic stress over a period of time can lead to an earlier menopause, earlier symptoms of perimenopause, and an earlier menopause where the period stops completely. And again, with the mood, anxiety, depression, with too much cortisol, you can also see that in perimenopause. There's fluctuating hormones when it comes to perimenopause. So fluctuating levels or diminishing levels can also lead to anxiety and depression. Same thing with hypothyroidism, depression, anxiety in some cases, and blood sugar dysregulation that can also lead to erratic blood sugar swings, and then also anxiety and depression as well. So the final piece that I want to talk about is perimenopause. Perimenopause is typically several years to maybe a decade or longer that leads up to menopause. And it usually means that the hormone levels are fluctuating, they're going up, they're going down, they're going back to your normal. And at some point, they ultimately drop in preparation for menopause. So perimenopause often can lead to symptoms of irregular menstrual cycle or regular menstrual bleeding that can lead to mid-cycle spotting or skipping a period for a month, anywhere from several months. I have a lot of my perimenopausal clients that I've worked with over the years that will not have a period for 10, 11 months, and then they get a period, and it kind of starts that all over again. So if you have not had a period in 12 months and you haven't had anything since then technically you're in menopause. That's also going to be relative to your age, what else is going on in your life, what other health conditions, what other life circumstances, because sometimes the period can stop for a period of time and then it comes back, especially if it's not your time to be in menopause. So, perimenopause, irregular menstrual cycle bleeding, weight gain, especially belly fat, fatigue, interrupted sleep, hair loss, thinner skin, less elastin and collagen, less elasticity and suppleness of the skin, more inflammation, more achiness, and feeling like you have a sluggish digestion or sluggish metabolism, and that has to do with dropping estrogen levels. And that can lead to changes in that gut microbiome, which can affect the clearance or the regularity of the GI tract as well. And a lot of those symptoms, the sluggish digestion, that can be seen in hypothyroidism and inflammation that a lot of perimenopause and menopausal women experience, can be seen in nervous system dysregulation or too much adrenal stress hormones. Same thing with blood sugar dysregulation as well. And this conversation could actually go a bit deeper. There's a lot more integration and a lot more similarity between these body systems. That's why it is imperative that if you are unsure what symptoms you're having, whether it's the fatigue or the interrupted sleep or the weight gain or the crashes, mood swings, your changes to your skin, your hair, your digestion, your body temperature, cold intolerance, maybe heat intolerance as well, then it is imperative that you talk to somebody who actually understands all body systems and knows not only just the endocrine system, but also the cardiovascular system, the nervous system, the musculoskeletal system, everything, and how they impact one another, because it's easy to guess simply based on a Google search, an AI search on what might be happening. Also looking at advanced lab testing, so advanced thyroid testing, advanced cardio lipid panels, looking at your reproductive hormones, and looking at all body systems to really identify where that dysregulation can be. And in all the years that I've been in practice, one of the things that comes up again and again is this is actually very common, where the lab tests are normal, but you don't feel normal. You don't feel right. You don't feel well. You feel like there's something off or there's something wrong. So making sure that somebody can compare your symptoms with the lab test. And that's what I do with all of my clients is I compare all of your symptoms with the lab tests, and then I come up with an evaluation based on what you share with me. What happened a few years ago? What happened at this time when this particular symptom started, or when this condition started, or when you were diagnosed? But also collectively the symptoms today, and compare that with the data in the lab testing. And then you're going to get that synergistic whole person perspective of what's really going on. So it's that nuanced, integrative blend of looking at everything. If this was helpful for you, please subscribe to this channel.